Welcome to the Pulse of Healthcare. It's Dr. John McCormick, and I'm here again with my buddy Nick, who's about to do something. I'm not sure what it is, but it's going to be big.
Planning.
Going to be big. He's planning it.
Don't worry, I'll do it.
It's happening. It's happening. I actually feel it happening right now. I don't know what it is. It could be that or maybe indigestion. I'm not sure. Ooh, yeah. I can tell you something that did give me indigestion, though. This was looking at that articles that's been coming out this week where that our DOJ is filing charges against 455 different folks to the tune of about 6.5 billion with a B in Medicare fraud. And I'm like, wow. And this is just what we know about. And this is, I hate to say, it's just isolated. We know this goes on all the time. And we're hearing about it from the government side, from a governmental plan. But this also happens in commercial insurance all the time, right? You just don't get a big splashy news story about it. And of course, several of those perpetrators of fraud are right here in our greater Houston area. And it crosses over. It's not just one thing, although the articles kind of zero in on wound care because there seems to be a lot of fraud in that particular lane. Mm-hmm. But it's also mental health and pharmacy and, imaging, it was unnecessary and all these other kinds of things. So it wasn't, one person sitting in their office doing one thing, although it appears that one particular practice was more egregious than others to the tune of about $100 million. Is that what it was?
$100 million. I think
$100 million.
182 million. It's almost 200.
I mean, if I'm a private practice doctor and I'm driving a Lamborghini around and I don't have a patient population that would support a Lamborghini, I'm thinking there might be something. there might be some fraud going on. if you have 3 or 4 exotic cars and $35 million in the bank and only 1,000 people in your practice. I'm just saying there might be some fraud going on. I don't know.
It's possible.
So today I kind of wanted to talk about this because a lot of times what we hear about from the physicians, and of course from the media who's acting, trying to advocate for member rights, and I totally agree with that, is, the devil of prior authorizations and things like that. And anytime I see an article where there's $1 billion in fraud or hundreds of millions in fraud, I think, well, the carrier bears some of that responsibility because they should have processes and programs in place that would identify particular practices and particular treatment regimens that are prone to fraud. All right. And if they were doing an actual evaluation of the medical records to look for medical necessity, they could probably get ahead of that. Right?
Yeah.
So you run our front desk, right? You take a lot of the calls.
Well, I'm not the front desk anymore. I'm not front of line.
Front line. You're front line as far as I'm concerned.
Okay. All right. Front lines. All right.
All right. You can be in the rear with the gear, right? That's
rear
a military term, right?
I wasn't in, so. Yeah.
All right. So in your case, you do coordinate a lot of care.
I do, yes.
Right? And before the podcast, we were having a little bit of a discussion about the difference between coordinating care and what publicly is talked about as a prior authorization. Right? So when somebody calls you and they need to go see a primary care doctor, and you coordinate that, are you authorizing that visit, or are you just coordinating to make sure they're getting good care?
I'm just trying to coordinate, make sure that they get with a good doctor who's going to help them out.
Describe that to me. When you say a good doctor, does that just mean any doctor that's like happens to be in their neighborhood?
Well, I mean, we try to look for doctors in their neighborhood. We don't want to make them drive too far, right? But we also got to make sure that the doctor is providing quality service and also willing to negotiate a fair, or not negotiate, bill at a fair rate, right? So that they're not, one, overcharging the member, and also overcharging for things that shouldn't be overcharged for, you know?
Or providing things that are perhaps not necessary, right?
Right. Like what, average office visits like $150, cash pay ish,
Right.
maybe 125, 175.
It kind of depends on what part of town you're into, sure.
Yeah.
So there's a little bit of variance there,
Right.
but there's a range
Yeah.
of what a reasonable cost for care is.
Mm-hmm.
All right, and we know what that is. All right. What we also know from being on this side is we know physicians that do high quality care at fair rates, and we know physicians that don't do high quality care
At fair rates.
all right. Even if there were fair rates, it's not high quality care, and some of them charge exorbitant rates for not high quality care.
Yeah.
Now, you don't go out to the member and say, they go like, I want to see Dr. Bob down the road, and you know Dr. Bob.
Yeah.
Dr. Bob is no good. All right, charges too much money. You know,
Get stuff you don't need.
always upcharging. Takes a long time to get appointments. Sometimes, whatever the range of things are that we know could be, I'm going to say, not so good. You know, because we do something called credentialing for all of our physicians. We know how many times they've been sued, what they've been sued for, if they have any malpractice things going on. Those are the kind of things we don't reveal to the member. We go, you don't really want to see Dr. Bob because he's in the middle of 2 malpractice suits right now. We can't say that, all right? But we can say, you know, we really highly recommend Dr. Susie down the road, who's just going to get you in, you know, in the next couple of days, and it's going to make sure you're well taken care of. And because you're coordinating our care with us, you know, your cost for that for our plan is going to be free.
Yeah.
Right?
Yeah. Able to waive the copay.
So not an authorization. We're not saying you can't go to the doctor. We're not authorizing your visit. You can go.
Yeah.
We're just coordinating to make sure you're getting the best care at the best rate.
Yeah.
Right? So now let's say you went and saw Dr. Susie. You did what you were supposed to do, right? And Dr. Susie says, you know, I'm checking you out here, and I think you need to go see a cardiologist.
Mm-hmm.
All right? Are we going to question Dr. Susie's recommendation for you to see a cardiologist?
No.
No. Are we going to? So we're going to quote unquote authorize that, right? Under the definition that's used.
Right.
Right. And so we're gonna prior authorize your visit to go see a cardiologist, but we're really not authorizing it. We're like questioning Dr. Susie's judgment.
Yeah, the authorization is just looking at the referral and be like, yeah, all right.
Right, and then once.
Oh, but it's also we don't require the referral either. That's what HMO that requires the referral.
Right. Sometimes HMOs or PPOs, depending on it.
Depending on the post.
Right. You might need a referral, but in this case, again, kicking it back over to you, you're just going to coordinate that care, try to get them set up with what we would consider to be a highly rated cardiologist, right?
Yeah.
All right. And the reason we want to do that is because first, we want to make sure you get good diagnostics and good care. And second, we don't want you to start going down the road to an unneeded surgery or something like that because you went to, you know, I hate to say some specialist that might be more prone to do surgeries instead of different types of interventions, because I hate to tell you, in our very perverse system, we reward sickness, right? Doctors don't get paid if you don't get sick. Surgeons don't get paid unless you need a surgery. Right? So sometimes the doctors that are surgeons or tied to surgeries, you know, incentivized to drive people towards surgeries through their hospital connection or whatever, right, may not necessarily be taking some intermediate steps that could cure you.
Yeah.
And I'm a perfect example of that. Me, personally, perfect example.
Mm-hmm.
All right? One of my unneeded glands had shut down almost. It was like 7% functional. That's surgery time, right?
Mm-hmm.
My sister, who is a doctor of Chinese medicine, said, I have a regimen that you can do that will help that particular gland wake back up and should help you. And I was in excruciating pain.
Man.
All right, I felt like somebody was stabbing a knife right into my side. And so, of course, got pain medication, and now I'm going to see the surgeon, and I went and got the test, and so good diagnostics, right?
Yeah.
Started the regimen, within a couple of weeks was feeling great, right? Went back to the surgeon, and to his benefit, the surgeon said, so you're not hurting anymore? I said, nope, went away. Said, I think we ought to run another diagnostic test. Ran another test. Not that the test is cheap, but it's way cheaper than the surgery and didn't have to get my body cut on.
Yeah.
He went, hey, guess what? Looks good. Woke back up. Not 100% functional. You're old and you got some other things going on. They're a little bit broken still, but you don't need the surgery. And he, but his follow-up was, if this pain recurs, right, if it collapses again, we probably are going to need to do the surgery. Intermediate step, done that. Now, had I not been a educated consumer of healthcare, right, I could have done exactly what my plan allows. And I'm retired military, so I go through TRICARE. And they would have approved that surgery, and I had it done. One done. All right. I had to seek an intervention. All right.
Yeah.
We at Ovation Health kind of have that mentality. We're not trying to prevent you from getting any care that you need ever. All right. What we're trying to do is make sure that we've in collaboration with your physicians, evaluated all the options, or making sure we're taking the appropriate intermediate steps so you're not doing an unnecessary surgery.
Yeah, and that's oftentimes the case with medication. I feel like that's the most common instance of that, right? Either that or, I want to go get this surgery done. Can you recommend me a surgeon? Well, have you tried going to physical therapy first? Oftentimes they just going to a physical therapist for a couple weeks.
My shoulder hurts.
Fix
I need
things
surgery.
that you thought they couldn't, right?
No, you need to go strengthen the muscle group around your shoulder.
Yeah.
And then suddenly you don't need surgery anymore because now your joint isn't slipping and causing you pain.
And it's not like all these surgeries will magically fix everything too. Because personally, I have scoliosis, right? I could go in and get a metal rod put in my spine, but every day it'll feel like I have a metal rod put in my spine. So I would rather go to physical therapy. Yeah, they might not be able to completely cure it, but they'll give me the tools that I can use to strengthen my body to where it won't be as, not noticeable, but it won't have as much of an effect on me as it did before.
Well, the metal rod's not a cure, right?
Right.
It literally is just a permanent lumbar support, if you will, right?
Yeah. Which doesn't sound
doesn't
better
sound fun to
at
me.
all.
Well, and we know from our own experience, and not to digress into back surgeries, but we know from personal experience that 60% of back surgeries fail. Right? They fail. So even though the people that go and get back surgeries and get their, I know I'm going to get emails that say, my back surgery was great. Right, 40% of them work. All right, you're in the 40%. Congratulations. All right. But we know they fail. And they fail because, people are out of alignment. They're not doing the strengthening. They're not doing other things. They just go, well, let's get these vertebrae fused together or a metal rod put in their back and suddenly they're in more pain and they're less flexible
Yeah.
and they didn't do the other things that were needed, like, get up and go for a walk.
Yeah.
Stretch out.
Right.
Stretch out.
Your spine's straight now.
Yeah.
Your spine's straight. That's it, though.
For a while.
Yeah, for a while.
Lose weight, So there's a lot of things going on. So, fraud. It's a big deal.
It is a big deal.
And it's and I think there has to be a collaboration between the member seeking care,
Mm-hmm.
the plan, right,
Yeah.
and the physicians. Not only so you're getting the appropriate amount of care, but when you partner with a plan as an employer, right, you're the fiduciary on that plan. You, the employer, is responsible for making sure that those healthcare dollars are spent wisely, right?
Yeah.
So, I'm all about self-driving cars. Not really. Scared me to death. All right. But, you shouldn't treat your healthcare plan like it's self-driving. You're responsible for the activities of your plan.
Yeah.
If you're an employer and you're self-insuring, you're responsible.
Yeah.
So
Because you are paying monthly for it.
you're paying for that, and you're the bylaw fiduciary of it, which means if those dollars are being lost to fraudulent behavior on the part of the providers or the facilities or the prescriptions or whatever in that range,
Yeah.
ultimately you're the one that can be held accountable for that.
It's insanely irresponsible. Just throw money at something and not even know.
Take your hand off the wheel.
Yeah.
Take your hand off the wheel.
It's like, come on.
Come on, Tesla, drive me home. Drive me home. But that's also why it's important to find a great TPA partner like us that's going to help you do that, right? Finding fully transparent TPAs are rare.
Mm-hmm.
All right. The fact that we're happy to share data with you, we want to collaborate. All of those things are important because, everybody in this equation is trying to do the same thing, right? We're trying to provide high quality care at a fair price.
Yeah.
All right. And what we know is the way the healthcare costs continue to rise year after year after year is unsustainable. And when you burden that process with billions of dollars in fraud, and that's just a small segment of the population. So on the commercial side, you can probably take that number and triple it in what's going on in fraud.
Just because of what? It's less regulated then, maybe?
Yeah, so if there's 6.8 billion in fraud for Medicare and Medicaid, you probably have somewhere in the neighborhood of 18 to 20 billion in fraud going on the commercial side across all those commercial plans for unnecessary testing, unnecessary procedures, upcoding of procedures, all those kind of things. So critical that you find great partners that can help you manage that. Otherwise, you're just going to be on the same wheel as everybody else where you're paying 10, 20, 30, 40% more every single year, year after year after year. Right? And you just can't get off of it.
Yeah.
So I said all that to say three things, right? We know fraud exists. We would love to think that every provider out there in the world is 100% legit and above board. The fact of the matter is they're not. All right? We would like to think that every plan out there in the world has your best interest in mind and wants to make sure you get all the care that you actually need. The fact of the matter is they don't.
Yeah.
All right? So as somebody that's going to be your partner in healthcare, it's so critical that we approach this thing with our eyes wide open and use the only tools that we have available, all right, which is a good evaluation of the physicians, a good evaluation of the facilities, clear-eyed understanding of what the medical needs are, and the different levels of care, the different interventions that can occur prior to doing a surgery, and then when surgery becomes necessary, that we're doing it at the right place at the right price. Right? That's how we prevent fraud. That's how we manage care. And I hate to say, that's why prior authorizations are really necessary, when going down this road. At least somebody with their hand on the wheel all the time.
Right.
So what do you think?
Well, I think
I think you brain shorted out. That's
yeah,
what I
I
think.
think it did just short it out. Yeah, no, it's super important. We gotta be using this. You gotta use your brain. You gotta use your brain. Gotta look at the stuff you sign up for, and yeah, no, that's it. That's all I got. That's all I got today.
Take ownership.
Take ownership.
All right.
Take ownership.
Thanks for joining us.
Yeah.
Pulse of Healthcare. We'll be back in 2 weeks.
2 weeks.
All right, have a
Take it
good
easy.
one. Bye.